all of us have struggled one way or another during this pandemic. The isolation has been really tough, sometimes just too much to handle, especially for those who already feel so alone as they struggle with mental illness. Matter of fact, psychological distress has affected about 1/5 of U.S. adults during COVID. So to honor Mental Illness Awareness Week, we want to talk about it, offer some help, and try to break away from the stigma that keep so many of us from seeking help. Psychologist Dr. Courtney Tracy, also known as the Truth Doctor, is here with us, along with the CEO of the National Alliance on Mental Illness, Dan Gillison. So glad to have you both here this morning. Appreciate you.
Yeah. Great to be here.
Dr. Tracy, let's start with you, Dr. Tracy. What kind of changes have you actually witnessed with those struggling with mental illness in the past year and a half?
It's been significantly overwhelming because the people who were already struggling are now experiencing increased isolation and a reduction in the type of resources that they're capable of receiving. So it's not only been an increase in the symptoms that they've already had, but it's also been people experiencing new symptoms that they don't know how to handle because they didn't experience it before this pandemic that we're in now.
So what have you done to try to reach those people? And what are the resources that you've used? And what are you recommending to those that are struggling, especially with the new symptoms?
Well, the resources that I've been providing is I've been on social media for almost the last 2 years trying to provide education about different symptoms, different diagnoses, and different presentations based on different cultures and different locations, geographic areas, and different employment and education situations that people may find themselves in, because mental illness shows up differently for each person. And the resources that I've been recommending for most people have been contacting their local doctor or using the internet to figure out, are these symptoms something that are something that I should be reaching out to other people for? Should I be discussing it with my friends and family first? Or are these typical symptoms of being in the middle of a global pandemic? Education is really, in my opinion, the #1 thing right now because people really are unaware of when it's time to reach out.
You know, it's nice as I look at your videos, whether it's TikTok or whatever platform you're using, there's a sense of privacy here for folks because it's not easy to talk about. It's not easy to seek help. It can be very expensive to seek help. So have you found that this has been comfortable for folks that are reaching out, is to utilize what you're doing on social media?
I think that the internet provides a great barrier for people to not only be somebody that they may not be in person in a negative way, but I also think that it's helpful because people are able to maybe not have that direct conversation with a doctor or a family member because they're nervous or perhaps because of the stigma. And so they're capable of learning about these disorders and these diagnoses from an impersonal standpoint to be able to gather the information themselves and then decide, does this sound like something that I should be reaching out to help for?
And now in this new world of how we can seek help, Dan, what is the National Alliance on Mental Illness doing to lift up this week and offer resources and help and more information?
Yeah, thank you, Kira. And what we're doing is we're looking at this as a week to raise awareness, to increase advocacy, and to educate. And the other thing that we're doing is to your earlier question in terms of what has been going on in during COVID the last 20 months and how we've seen this just increase. The other thing we've done is we've increased our helpline hours. So now our helpline is from 10 to 10. And we've done that over the last year because we've seen the increase. And just as a metric, year over year from January to September of 2020 to January of September of 2021, 2 areas that we measure, we've seen 196% increase in the calls looking for resources for mental health crisis and 164% increase looking for resources on suicidal ideation. So those are just 2 of the areas that we've seen a tremendous increase. We've grown our volunteers that actually are peers that manage the helpline from about 35 to 40 to over 130 volunteers that have lived experience that are on the helpline, and that is at 1-800-950-6264. And then we're in over 650 communities across the United States, actually in the communities doing the work.
So, Dan, I actually have a friend that is struggling right now with mental illness. She doesn't think she needs help. Her family has tried. I have tried. It's actually a really sad situation, and I think about it every day. I don't know what else to do. For me and other people that are trying to seek help for someone who doesn't want to or doesn't realize they need it because of the mental illness, what do we do?
Yeah, thank you. That is the million-dollar question. And one of the things that we say is, first of all, we meet you where you are, not where we want you to be. And we try to listen as much as we can. And then we try to find who is that trusted medical person that your friend would listen to. Could it be their primary care physician? And if so, is there the opportunity to encourage them to see their PCP and actually have a mental health checkup? So it's actually making sure that we, first of all, listen. And I would also encourage that we have a number of resources and frequently asked questions like this in terms of how to. And there's no magic bullet, but there are different ways to approach it. And I would say, who does your friend have in the medical field that they have had as a trusted advisor and someone that they would listen to? And is there a way to get them to see that person?
That is actually fantastic advice. Matter of fact, I'll be reaching out to you after this segment. Dr. Tracy, a lot of disinformation is out on social media platforms. What you are doing is clearly different from that. So how do we know, how do others know what they should watch? What is good advice? What is misinformation?
That's a great question. I think the first thing to realize when you're absorbing mental health education information through social media is to realize that you can't really self-diagnose yourself looking at a list of symptoms or criteria for diagnoses, because there's lots of variables that go into whether or not that diagnosis actually applies to you. But at the same time, I think that it's important to gather information from wherever you can and from credible sources. So I separate people that share information on social media about mental health in different ways. There's professionals that have experience and education. Then there's professionals that have education. Then there's people just sharing their lived experience. And I think that the priority, if you're really someone that believes that they may be struggling with a mental illness, it's to take that information from credible sources. So professionals that are licensed and have the education will usually list their credentials on their profile, as well as a disclaimer describing what type of information it is that they're providing and what the next steps would be if you feel like you see yourself in any of their posts.
Dr. Courtney Tracy and Daniel Gillison, thank you so much for your time this morning and appreciate the conversation.
Thank you so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.